That's an interesting question, one that I get often in my practice as well. It's estimated that almost 15% of women in the United States have some type of orgasm disorder. Either it's diminished, it doesn't happen every time, and it's estimated that almost 10% of women have never had an orgasm. The causes of not having an orgasm are prior use of birth control pills, prior use of antidepressants or being on antidepressant medication, prior emotional or physical trauma. If someone has been assaulted in the past, they may not be able to associate any pleasure with intercourse anymore. Bad birth experiences or tears or nerve damage. It can be as simple as menopause or altered hormone levels. So there's a multitude of reasons that women can't orgasm, but I tell my patients it's common, it can happen. You know, we used to think that there weren't that many treatment options, but going out to the San Diego Institute for Sexual Medicine and being involved with the International Society for Women's Sexual Health, you get to meet with all these great minds and learn all this data that you may not have learned in medical school and realize that there are treatment options out there. It can be as simple as testosterone therapy, hormonal therapy, lubricants. There are some other medications that can increase dopamine levels in the brain. And that's a key component to be able to have an orgasm for a woman. So the pelvic floor is a group of muscles. This group of muscles is responsible for support for our pelvic organs. It also helps with bowel and bladder function. These group of muscles, though, the tone of them are key to contract and also to allow us to have intercourse and orgasm. And we have a lot of women who come in with pelvic floor dysfunction and they've been misdiagnosed with chronic pain or other symptoms when really it's a treatable issue. A lot of women will develop pelvic floor problems after having babies. Treatments are medical massage. We sometimes give Botox, injections, muscle relaxants. A patient who comes in with this needs a thorough exam to make sure that it truly is pelvic floor. But these patients with therapy can get so much better and can get back to living without daily pain and going back to having a satisfying sexual experience.